Hello, I'm Francesc Malagelada. I'm an orthopedic foot and ankle consultant working at the London Independent Hospital in London. And as a foot and ankle specialist, I see a wide range of conditions. And patients come to my clinics for different reasons. These could be hammer toe deformities or bunion deformities, as well as sports injuries, perhaps Achilles tendon ruptures or ankle sprains very commonly as well. But probably the most common presentation in my clinic is one of ankle and foot pain. And contrarily what most people might think, patients don't need a referral from a GP or another doctor to come to see me. They can directly call our secretaries and organize an appointment straight away in our clinics. When a patient is complaining of pain, most commonly we would organize an examination in clinic, and that would involve a workup, probably with x-rays or other types of scans, to figure out what is causing that pain. Once these investigations are back, then we can organize a treatment that is customized to every condition and every patient. One of the commonest reasons for foot and ankle pain that we see in clinic is arthritis. The type of arthritis I'm referring to is osteoarthritis, which is a wear and tear of a joint. It's normally affecting one or a couple of joints only, and it can affect patients at different ages. It could be middle age or younger patients. And they normally come to clinic with pain and some degree of stiffness. Probably most people have heard of knee or hip replacements, which are used to treat arthritis in those joints, but it's less commonly heard of the concept of ankle replacements or big toe replacements. They're also available these days to treat arthritis in the foot and ankle joints. And osteoarthritis is a condition that won't develop from one day to another. Patients will start developing pain that's been ongoing for a number of months, and it normally doesn't improve with the regular over-the-counter painkillers. And also they would start getting a bit of stiffness in that particular joint that's affected. So when this pain has been ongoing and it hasn't improved over the months, it's probably the right time to ask for a consultation with a specialist. And despite we are called surgeons, as orthopedic consultants, we can provide the whole spectrum of treatments. In a matter of fact, most of the patients won't need any surgery to treat their arthritis, and we offer an array of non-operative treatments, and these might include physiotherapy, injections, some insoles that can be custom made, and every patient will benefit from some of them or a combination of them. It's only in selected patients when the arthritis is very advanced that we might offer an operation, and in those cases we can do either replacements, as we talked about, or some keyhole surgery to clean up the joint. So keyhole surgery is a type of surgery that uses small incisions to access either a joint or areas in the bone that can be addressed by specific instruments. So you have a camera that can be inserted into the joint and the instruments to address any pathology or any injuries that are seen within the joint or in the bone. Depending on the area where you act, these instruments are specifically designed to deal with that specific condition. And the benefits of these surgeries that by doing less surgery, you end up getting a faster recovery and less post-operative pain.